significantly impacts on our unemployment. And you support women by making sure families are strong, and you support overcoming poverty issues, which lend to the unemployment rates in our riding, by making sure that people have alternatives, affordable housing, access to education, social services.
Thank you. Zenny Martman.
Thank you. Well, first of all, the government can help create jobs with the National Infrastructure Renewal Strategy. That will not only create jobs in our own communities, it will also draw investments. But another way we can do this, and having been a member of the Chamber for so long, I'm very aware of all the small businesses we have throughout our riding. And what the New Democrats want to see, instead of, we can save $5.9 billion on the corporate tax cuts, and we can invest in small business. We would take the federal tax from 11% down to 9%. We would give incentives for any new hires for up to $4,500 for a business. And we would also regulate the merchant fees that are paid to businesses, but that they have to pay for credit card and debit charges. Now, I've been around talking to small businesses, and one person in Qualicum told me she pays out $400 a month in those transaction fees alone. We need to help create more business and support the small businesses that we do have in our communities, and that will help keep the jobs here as well.
So to offer those small businesses those kinds of breaks, how do you pay for that?
With a $5.9 billion corporate tax break, we would take them back to the 2008 levels, which would be 19.5%. Right now, they're set to decrease this year and set to decrease again next year. These corporations are making record profits. They do not need this assistance. We have, our platform is fully costed out. We have our economists that look through it. We know how to take the money, as Renee had said earlier, from those that are the wealthiest, and start supporting the people and the small businesses right here in our own communities, making life more affordable for our families and supporting the small businesses. That's a strong economy. It starts from the bottom up. Pay workers good wages, we will see the businesses thrive.
Thank you. Our next question is Myron Jesperson. What advice would you give constituents who are opposed to Nanaimo's Housing First strategy, which aims to provide low-barrier housing for most of the city's homeless, drug-addicted, and mentally ill population?
I feel like this is a bit of a soft lob question, because this is what I've dedicated the last 4 years of my life to doing, and that is working on the issue of homelessness in Port Alberni. The advice, and I followed this issue in Nanaimo, and I understand the sort of gut reaction that happens when people say, we don't want this in my neighborhood. The reality is that an investment in social housing in any neighborhood, and even when it's social housing to house some of our hardest to house, is an investment that improves our neighborhoods rather than detracts from our neighborhoods. And we've seen this over and over and over again in Port Alberni, where we've had projects that were opposed initially, and then we sat down with the community and explained what the project was and how it would operate, and got approval to go ahead with it with a lot of skepticism. And now I can list off about 4 of those projects that we've worked on in Port Alberni that now have pride of place in our community. They're the kind of place that people drive by and show to their visitors as examples in their neighborhood of something they can be proud of. And to add to that, I would like to just point out how critical it is for us to focus on providing housing. Housing is one of the key elements to taking care of some of the other issues that go into making people homeless. Things like mental health and addictions, things like crime, things like poverty. When we provide stable and secure and supported housing, we really make a dent in a lot of those other issues that make people afraid of having that kind of housing in their neighborhood.
Thank you. Renee Miller, 1 minute, please.
Thank you. An excellent question and an excellent response by Myron Jesperson, and I only want to add to it in this respect. When we do good things for bad people, allegedly bad people, we strengthen our economy, we strengthen our country. It's false. It's a false economy to think that the social services that we already provide to those people, the drug addicted and the mentally ill, in the form of incarceration, it's fiscally irresponsible to incarcerate them in the numbers that we do for the price that we do, when providing them an alternative in affordable housing can accomplish much more than incarceration at a fraction of the price. It's poor economics to not invest in affordable housing and to not invest in resources and services for drug addicted people and mentally ill.
People here aren't opposed to the idea of it, they just don't want it in their neighborhood. They're concerned about their property values and the safety in their neighborhoods. How do you respond to that?
I can respond to that by encouraging people to go out and have a look at some of the Kool-Aid facilities popping up around the island. Those facilities add to neighborhoods. They're beautiful buildings. They're well managed. There's the not in my backyard mentality it has to be overcome. Those people are deserving of those facilities, and they're not detracting from our neighborhoods.
Thank you. Zenny Martman.
Well, as chairwoman of the Social Planning Advisory Committee, I can assure you this is something we've been working on for about 10 years. This has been very open to our communities. We've had open houses over the last 4 years, but now that the ground is actually about to be dug, we have some neighborhoods that have concerns. I understand the concerns, but I also know that we're modeling it on different areas like Oregon and New York and other cities, Toronto, that have been very successful. We will have a healthier community. There is no way we are going to put any child in harm's way. What we need to do is work collaboratively and show people that we have other examples such as Warmlands, that when Warmlands, they had the same issues in Duncan, but once it was up and running, the children and the PAC now actually fundraise to support the home. These houses, we have good neighborhood agreements. We will have 24/7 support for the homes. This is something we need to do to be successful in our communities. I'm very proud of it. I want us to achieve it.
Thank you. James Lunny.
Well, we have a little bit of history in this, in the area. I remember a few years ago when we expanded the New Hope Center with the Salvation Army, that they got $1 million from the Homelessness Partnership Program, that there was resistance even to that program expanding initially. The challenge with these programs, and I think wisdom says they need to be small in scale and integrated in the community rather than concentrated. I think we need to be working with all of our social agencies to make sure that people have an opportunity to be transitioning back to successful lives in the community, in as much as that's possible. And I think we need to have a look at successful models that have been in place in other communities, and the people need to be informed of what a successful model looks like, and that conversation needs to take place and go on. Overcoming the NIMBY dynamic is always a challenge, but I think as that social discussion goes on and successful models are examined, there will be opportunities to break through in those areas.
Are you able to offer assurances to the people here that the things that you talk about are being done in this case?
Frankly, that's you're talking about a local and a provincial issue, not a primary federal initiative to convince people in the local communities how and where to accept these. But I think there is a role for everybody in having a social conversation about how to overcome those obstacles.
Right. Certainly the federal government, you talked about the New Hope Center and funding in there, so it is certainly an area that the federal government is involved in.
Exactly, but convincing local residents is a challenge for the entire community together. It's not a federal issue alone.
Our next question goes to Renee Miller. With an aging population and Vancouver Island a magnet for new retirees, are you concerned with the lack of a hospital in Parksville, Qualicum, and what can be done about it?
Funding for healthcare is critical, and making sure that funding and resources are available to sustain universal healthcare are equally critical. that funding initially, and that legislation initially introduced by a Liberal government in the 1960s, a Liberal minority government under Lester V. Pearson, and the Liberals are committed to making sure that health care is available. I will work to make sure that whatever funding is available federally can be brought back to this riding in order to support medical institutions in our riding. Having a hospital available in Port Alberni is critical to those people, and it's made living in Port Alberni that much more accessible. For Parksville Qualicum to have to travel either to Port Alberni or to choose to travel to Nanaimo, they do so in jeopardy of their own health. Absolutely, I support any initiatives that are coming, and I can advise that the Liberal platform is making sure that healthcare workers are available to staff those facilities in the form of forgivable student loans to doctors and nurses willing to practice in more rural settings, and Parksville Qualicum would apply under those circumstances. So this is something that the Liberals are committed to, and we will be able to follow through on that commitment.
Thank you. Zenny Martman.
Well, this is where the federal government needs to have more national policies. We tend to have this finger pointing of saying that's provincial responsibility, that's federal, that's municipality. We need to work together and have a national strategy. Absolutely, the whole Oceanside area needs urgent care. And they don't mean a clinic. They mean somewhere where if somebody has their hand cut from working on the farm or something, that they can go and get it stitched immediately. This is vital, important, whether it's seniors or non-seniors in that whole Oceanside community, let alone if we had any type of disaster, etc. The Nanaimo Hospital is overburdened right now as it is. To have to take those residents from the communities that are growing, and as you're saying, more and more people are retiring to, absolutely they need urgent care. And what we can do is designate funding from the federal government to say it's for specific programs.
Thank you. James Lenny.
Okay, good. Well, it's an important local issue for sure. Full-service hospitals are one delivery model. They're certainly a very expensive model, and everyone would like a full-service hospital in their community. Of course, delivery of the services is a provincial mandate, and VHA has the responsibility for all of Vancouver Island. I believe that, from following the local discussion, that the expanded community care facility in Parksville is going to make more extensive multidisciplinary services available to the local community. And that's certainly a step in the right direction. As the population of the Oceanside area increases, eventually, I have no doubt there will be a full-service hospital in the region eventually. However, I think another even more germane issue for this riding is actually the West Coast Hospital in Port Alberni. There's some discussion about that being maintained as a full-service hospital. I think because of the remoteness, the transportation issues, and the isolation of that community, sometimes because of the hump, and dealing with an expanded tourist population on the West Coast in summer seasons, that hospital does warrant increased services.
Thank you. Myron Jesperson, please.
My short answer is I don't know. I don't know enough about the specific details to say. I'm well aware of the issue, and I certainly understand the concerns, particularly of retirees in the Parksville area, about having access to health care closer to them, particularly as they look at maybe difficulty of transportation. So I think some of my colleagues have already referred to this. Whether it needs to be a full-service hospital or not, I think is questionable, but having better access to health services in Parksville, and particularly the health services that are geared to the retirement community that might have transportation issues, I think is a good thing. We could also think about better access to public transport so that people who do have problems getting around have access to get to Nanaimo or Port Alberni without having to drive themselves.
Thank you. Our next question goes to Zenny Martman. Should we risk job creation on Vancouver Island by putting a moratorium on both shellfish and salmon farming?